Well, hello and warm welcome to Alison-McWhinnie Podcast, where we have conversations for business and wellbeing success. And today's conversation is very much focusing on well-being, and in particular, the health behind your smile. A warm welcome to Erica Ferrar, who is an experienced health and wellness coach and practitioner, and who is located in Kingston-upon-Thames. Now, Erica has a 40-year background as a dental hygienist. Erica, you don't look old enough for a 40-year background.
Oh, bless you, that's so kind.
So you're doing something else, and that's probably another podcast. Where she's developed her interest in health and well-being. She's introducing a new service as part of her business as an oral health coach, whereby she can help people to transform their health and their smile, one habit at a time, empowering people to take back control of their own health. Erica, very warm welcome.
Thank you. Thank you for having me.
Oh, I think this will be a very fascinating subject, and it has far-reaching implications than I certainly realised until we started talking about doing this interview. So I'd like to take it right back to looking at the medical facts and connection. Okay. Is oral health just about teeth?
No, it isn't. I think historically, looking back, the mouth has always been seen in isolation from the rest of the body. If you think about it, dentists treat mouths, doctors treat the rest of the body. And it's not really seen kind of together. But the fact is, the mouth is the gateway to the rest of the body. The mouth is connected to the stomach via the esophagus. It's connected to the lungs via the trachea, and it's connected to all the other organs, the heart, the brain, the kidneys, the liver, everything via the bloodstream. So there is indeed a huge connection between the mouth and the rest of the body, and any disease-causing organisms or pathogens that are in the mouth can transfer themselves, migrate to other areas of the body via these routes. And there's been over 40 years worth of research into this link between the mouth, the disease-causing links between the mouth and the rest of the body. And we now know it as it's called the oral systemic link.
So what can neglecting oral care lead to then? What kind of illnesses are we talking about?
Well, if we think about, the diseases that it causes in the mouth itself, neglect will cause tooth decay, gum disease, we think of things like bad breath, all being caused by neglect, by not cleaning properly. But also we are now looking at that neglect, what that neglect can do to the rest of the body. So, the first one that was discovered actually, the 40 odd years ago, was the link between gum disease and cardiovascular disease, heart disease. That has been the one that's kind of been on the horizon for a long time. But we now know there is a link between gum disease and strokes and Alzheimer's and certain cancers, rheumatoid arthritis. Pretty much any inflammatory disease in the body can be linked back to gum disease, and kind of vice versa, really. So neglecting oral care is really importantly, gum disease and tooth decay, but there's a much wider impact on the rest of the body.
And talking about wide impact, am I right in thinking that actually it's been linked to no less than 55 inflammatory?
Yeah, 50,
Wow.
Over 55 different inflammatory conditions in the body. I couldn't name all 55 of them, but I could certainly give you, many of them, and they'll probably come up in this. But yeah, it's a lot, and it's growing all the time.
So taking things back to gum disease, what is gum disease and what are the stages of gum disease?
So gum disease is an inflammatory disease. It's one of the most common inflammatory diseases in the world. I think, maybe 80-90% of the world's population have some level of gum disease. It is a preventable disease and it's a manageable disease. But starting at the beginning with the early phase, so there are 2 stages. We have the first stage, which is gingivitis. Gingivitis is literally inflammation of the gums. It's typified by inflammation, bleeding, swelling, redness of the gums. And this, at this stage, is a reversible stage. When we notice that we have blood on our toothbrush or on our floss, and we take note of that, we know that there is something going on. Healthy gums don't bleed. So if we kind of pick that up at the earliest stage, go back, if you can identify where it's bleeding from, go back, do it again, floss more, really address that bleeding, and we can reverse it and return to good habits, okay, to prevent it from getting worse or prevent it from recurring. If we don't take care at that stage and we just allow it to progress, we'll get further inflammation, we'll get breakdown of the fibers and ligaments that hold the gum to the tooth. That will create pockets where bacteria will become more inaccessible, it will become more difficult to remove. It will start to eat into the bone, and then we'll get tooth mobility and potential tooth loss. So at this stage, the second stage is called periodontitis or periodontal disease. This is not reversible, but it is manageable and it can be stabilized. So gingivitis, catch it early. We can reverse it and make it all better. But it's a lifelong process. It isn't something that we can make better and then ignore again. It's getting into those habits that maintain that health at that stage, okay, to prevent the periodontal disease.
Mm-hmm. What factors increase susceptibility to gum disease?
Actually, there's a lot of factors. I was thinking about this, and you think about the immediate ones, not cleaning, will increase the risk. But there are things like everyone is different. Everyone's response to gum disease is different. So susceptibility can be increased by genetics, family history. You can have quite reasonable gum health, but if your mum or your dad or your grandparents had poor gum health, there is an increased risk that you will too. So knowing that, it's not a question we ever ask, but knowing that is actually quite helpful. Smoking, alcohol consumption, okay, will increase the susceptibility to gum disease. And obviously our diet, our nutrition, okay, so having a high sugar diet, refined sugars will increase susceptibility. Processed foods, inflammatory foods, are going to always increase the risk of inflammation. So there's a wide range. We have our own habits, our cleaning. If we don't clean properly, it's going to increase our susceptibility. So, but there's a far kind of wider reach of issues that can be looked at.
Does stress worsen oral health?
Yeah, there's quite a link between stress and oral health. Stress itself can compromise the immune system. So it weakens our susceptibility to all disease. It also contributes to low-grade inflammation in the body. But on top of that, we have factors like, when we're really stressed, chronically stressed, we don't take care of ourselves as well as we should. We don't clean as well. We tend not to brush. We might skip brushing. We might ignore red flags, like a little bit of bleeding when we're brushing or flossing. We just might not notice it, or we might ignore it and think it's not that important. So yeah, our personal habits tend to kind of go downhill a bit. We don't eat as well. We tend to revert to eating refined, sugary or processed foods. Okay. So again, not really taking care of ourselves. But also we tend to get an increase in things like mouth ulcers, which cause a lot of pain. If you've ever had a mouth ulcer, you kind of know how painful, and that can cause a problem with cleaning. And we tend to grind our teeth and clench our jaw a lot, which again can create tension and discomfort in the mouths. So there's a lot of factors that can impact, where stress can impact the way we look after ourselves, but that's going to impact on the way we look after our mouth as well.
I personally find as well that if I catch a virus like a flu, that can impact my oral health. Is that quite common?
Yes. Well, I think we saw also through COVID that that can have an impact. I think it's systemically through inflammation. If we have inflammation anywhere in the body, it can come back through the mouth, but also things like hormonal menopause. Things like menopause can have an effect and create dry mouth. So other kind of conditions within the body like that, flu, rundown, immune system low. Gum disease is predominantly, and it's an inflammatory condition, but it's also a condition of the immune system. And if our immune system is low, it can impact on that.
Picking up on your comment on the menopause, is there anything menopausal women should be doing in particular to try and combat a decline in oral health?
I think awareness is key.
Yeah.
As with anything, I think awareness is key. If dry mouth is the thing, and I have found from personal experience that dry mouth, sometimes a metallic taste, constantly feeling that need to drink water, which is great. It's what we need. But it can have an impact. So I think importantly, if anybody has any concerns, but through menopause, because we just don't know enough about it, go and speak to your dentist, go and speak to your hygienist, do some research. But there are products out there that can help with helping to stimulate the saliva in the mouth. I'm not a great advocate of mouthwashes, but there are mouthwashes and things that can help. But I think first and foremost, go and speak to somebody and see if that is the case. See if it is down to the menopause and not down to something else.
In your view, is there a best toothpaste and toothbrush?
Oh, toothpaste. It's a tricky one, this, because I have my hygienist hat on, but I also have my kind of holistic hat on as well. So it's a tricky one. So hygienist wise, fluoride I'm really kind of any fluoride toothpaste. They've got antibacterial agents, anti-tartar agents, all kinds of things. But fluoride is a bit of a controversial subject. Research has shown for years and years and years that fluoride helps to keep the tooth enamel strong. But in large quantities, it is also a hormone disruptor and a neurotoxin. And the more people know about this, the more people are having a backlash against fluoride. My view is, as long as people are informed of the options and what everything does, then they are free to choose what they want to choose. So the things I tend to recommend are either a fluoride toothpaste, but I am swaying a little bit more when I put my holistic hat on and I have those conversations. There are toothpastes out there now that contain hydroxyapatite. And these hydroxyapatite toothpaste, hydroxyapatite is what tooth enamel is made from. It's a natural substance. So it can help to strengthen through using the kind of same substance of the tooth enamel. So if people are informed, have made their own informed decisions, understand, have had the conversations or done a bit of research, they don't want to use fluoride, that is absolutely fine, because I do understand that the controversies surrounding it. So hydroxyapatite would otherwise probably be my go-to recommendation.
And is there a certain way that we should be brushing our teeth? And is there a certain time that we should be spending each time we brush our teeth?
So the way we brush our teeth, I think it's really important. I tend to recommend electric toothbrushes, simply because if used correctly, bear in mind they're only as good as the person using it. They do remove more plaque. They remove more biofilm, the deposit that can potentially cause disease. So I tend to recommend, and there are various ones, but used properly, they can be way more effective than a manual toothbrush. It's really important that when we're cleaning the bit where the gum meets the tooth, okay? Because if the bacteria, the biofilm builds up too much around this junction where the gum meets the tooth, that is what causes the inflammation. And then what happens is people think, oh, the gums are bleeding, I better stay away from them. I better avoid them and they'll get better. But actually what you need to do is you need to get into that gum margin and you need to remove that bacteria, remove the cause of the inflammation, and that's what will return the gums to health. So I think not being too afraid of that initial response to bleeding, clean the gum margin. 2 minutes a day is the minimum, really. We can't really do a better job. I always say 30 seconds on each quadrant, insides, outsides, tops. But remembering to do the gum margin, and then of course doing the between the teeth cleaning as well. Because however brilliantly you use a toothbrush, however perfectly you use the technique, we cannot get those bristles of the toothbrush between. So flossing, interdental brushes are a must. They are a must. Yeah.
Is it the case when your gums bleed and if you're brushing and you just keep brushing, is the blood actually helping to take away the bacteria?
No, the bleeding is a sign. It's
Okay.
first and foremost I would say it's the first sign that there is something going on.
Yeah.
I say to somebody, if somebody comes into me and they say my gums are bleeding, there's inflammation. Okay, so it's a sign. It's actually great because we know that there's something going on. If somebody comes into me and says, "Oh no, everything's great," and then they open their mouth and there's a whole load of redness and inflammation about, I'm a bit suspicious. But no, it doesn't take it away. It's a sign that there's something going on.
Yeah.
And it's that kind of red light that goes, right, okay, there's some gum disease in there somewhere, probably early, we can turn it around, but it doesn't take anything away, but it does alert us to what's going on.
And how many times a day do you recommend people brush their teeth?
I recommend generally twice.
Yep.
You can overbrush. So some people like to brush at lunch times. So I'm happy if that's a quick brush. You know, the morning and the evening brushes, you know, ideally should be, you know, spent your 2 minutes and doing it properly. If they want to do a quick one at lunchtime, then fine. But I would rather somebody brush twice a day really, really well, rather than 10 times a day really badly.
Yeah.
It's going to have a much better effect.
I'd like to turn to the holistic approach that we've touched on. Would you outline to us, please, the holistic approach to managing gum disease?
Okay, so when I'm looking, whether I'm looking with my hygienist hat on or my holistic, my health coach hat on, it is very much a combined kind of professional being. First and foremost, I would say if anybody has any signs or becomes aware that there's something going on with their gums, I would always state that seeing a professional, a dentist, a specialist, a hygienist is a must. You need to get a diagnosis. You need to know whether it's early reversible gingivitis or whether there's something a bit more deeper seated going on. So I would always say first and foremost that is key. But it can work in combination with looking at the holistic approach. We're looking at anything that's causing inflammation, anything that is weakening the body's defenses. Okay, so gum disease being an inflammatory condition that impacts the immune system needs to be considered. So stress management, okay, what stress is going on in your lives? Are you spending the amount of time that you should be cleaning the teeth? We know that stress weakens the immune system. So what is happening in your lives? Is there anything we can do to manage that? Sleep, sleep is a great stressor on the body. Are you sleeping? What can be done to help that? We're looking at diet and nutrition. Okay, what's the diet like? Is there lots of sugar? Is there lots of processed food? Are you eating anti-inflammatory foods, having your fish oils and your antioxidants and your fruit and your veg and your fiber, what can all help to impact on a general health level. It's a much bigger picture than just looking at the teeth and the cleaning. We really want to be looking at habits as well, the habits around tooth cleaning, but I think looking at the other anti-inflammatory things that we can do to support our whole body.
Yeah.
We talked earlier about inextricably the mouth being, linked to the whole body. We need to be looking not just at the mouth, but at the health of the whole body too.
So it's a full approach.
It is a full approach.
Yeah.
And the problem is a lot of the time in a hygienist appointment or something, we don't always have enough time. If we have a half-hour appointment, we have time to do our treatment, we have time to do our oral health instruction and go over the best ways to clean, but we don't always have enough time to talk about the other ways. We don't have enough time. We know about diet and we learn about diet and anti-inflammatory approaches, but we don't always have enough time to go through in detail these aspects, and I think we need to be looking at a bigger picture.
So you've launched this service, haven't you?
I have.
Tell us about that. It sounds very exciting.
Well, basically, it's a service where people who have gum disease and have had treatment, have a diagnosis, but sometimes aren't really getting anywhere. They've done all the cleaning and they've done all the work, but there is still an issue. There is still bleeding. The gum disease has been treated and we've got to a certain stage, but it's not getting any better. And we know sometimes that there is scope for improvement. There are things. So if we can't do any more in the mouth, what else is going on in the rest of the body? So I go through with clients, I help clients to look at their stress. Okay, what's happening? What can we do? Are they overwhelmed at work? What can we do to manage or to balance the stress in their lives? We look at the nutrition side of things. Okay, what's their diet? How are they eating? What are they eating? We're looking again, I look at their oral health, how are they cleaning? What are they cleaning? What are they using? Is there anything else that they can be doing? We look at their sleep. We look at all those daily lifestyle habits. What can we improve upon that's going to improve your general health, reduce inflammation within the body through changing maybe things that you wouldn't associate with the mouth? But will strengthen the immune system, that will reduce inflammation in the body. What else is there? We have, people who are really invested, really, really clever people who are professional people, really invested in their businesses, that maybe don't have time or don't to invest in themselves. And sometimes it's kind of those people that just need a little bit of guidance. So yeah, it's looking at a big picture, and it's looking at the things that aren't necessarily addressed, say in a hygienist appointment. We would like to address, but we just don't necessarily have the time to address, but on a much kind of more holistic scale. So I'm looking to help people who have done everything that they can and don't really know what else they can do.
Yeah.
And there's a little tweak somewhere that can really help.
Because you've got quite a holistic background, haven't you, as well as the hygienist background? Perhaps you'd like to share a little bit about that with us as well.
Okay. So as you said, I've been a hygienist for 40 years. That was kind of what I trained in, in my dim and distant past. And then I trained in the late 90s. Hygiene did tweak my interest, as you said at the beginning, in health, in the way the body works. I became really interested in how the body works, and kind of conversely, what happens when it's not working so well. And then I think I had a patient once who was a reflexologist who actually taught at a reflexology school, and I became really curious. And then I realized that there was a kind of a whole other way of looking at the body and how the body reacts to the environment. So I trained as a reflexologist in 99, and then I trained in Reiki, my first 2 levels of Reiki, in the early 2000s. And then it grew. I did chair massage and then, various other. And I wasn't really working professionally. I was kind of working with family and friends and kind of honing my skills, but still reading prolifically on health and different ways, an alternative way. And then in 2014, I originally opened a business. And then since then, I've kind of, again, just trained in more therapies. So different ways of using reflexology. I use reflexology on the face, and that can kind of help support people struggling with migraines and headaches and sinus issues, and including the kind of jaw clenching and tooth grinding. I trained as a health coach during lockdown, health and life coach, and now that's where I'm kind of combining my dental knowledge and my health coaching knowledge, and then holistic ways of working with animals as well as people. All beings. I'm interested in kind of helping all beings, really.
I think what you're doing is truly amazing, starting off with your hygienist training and now adding to this to provide a much fuller service and much fuller picture. How can people find out more about your business and get in touch with you to make an appointment?
I have a website,
Mm-hmm.
which is www.ericaferrarhealing.co.uk, or they can email me. There's a contact form obviously on the website, but they can email me on info@ericaferrarhealing.co.uk. Everything, pretty much everything I do is on there. And I was talking to somebody the other day and they said, oh, if you do too many things, it can be a bit confusing for people. And I was thinking, oh, I do hygienist and I'm a reflexologist and I do Reiki and this and that. And I was thinking, actually, it is all, there are separate entities to what I do, but it is all for the good of one thing. And that's being the best health and the best version of who we are. And in doing that, we need to look at the whole being. We need to look at all those aspects. And there is no one size fits all. So, I just have several different things that, people can, one thing may suit one person, one thing may suit another. And so, but it's all for the same central aim, to make people feel good, to make people feel better about themselves, and to help people, to help support people in their health.
Yeah, I would disagree with that person who said that to you. My view is that it's all interlinked.
Yeah.
And what works for one person doesn't necessarily work for another.
Yeah. Yeah.
And so I think what you have done very wisely is to increase your toolkit.
Yeah.
And so I think that enables you to help a wider range of people. So I think it's a very wise decision you've taken.
Thank you.
In closing, is there anything else you'd like to add to sum up, or?
I think it's just right what we said right at the beginning, that I got a bit disillusioned with my dental hygienist side of work, just because I've been doing it for a long time. And I was getting a little bit frustrated at not being able to deliver the whole picture, not having the time to say everything I wanted to say and give everybody the advice. And I think just helping people to understand that the health of the mouth and the health of the body is so interlinked. And we have all this information within the profession about the oral systemic link. And I think slowly, it will get out to the wider public, but it needs to be out there. People need to understand that there are so many things that they can do to help themselves.
Yeah.
And I think doing it the way I'm doing it, I still work 1.5 days as a hygienist a week, but I have my holistic side where I can help on that side as well. So there's always somebody that somebody can speak to. And if they can't find that person, they can find me.
Yeah. Erica, it's been lovely chatting with you today. Very insightful conversation. Thank you so much. And I'm sure that you will help a lot of people in the guidance and top tips that you have given. Thank you so much for being on this podcast.
Thank you, Alison. It was a pleasure.